Hello everyone, I'm Dr. Ndiche. I'm popularly called Dr. Delim. I'm a family physician. I worked in Murtala Muhammed Specialist Hospital in Kano, also called abets in Murtala, for a number of years. I've also worked as a volunteer at the Sexual Assault Center in the same institution. I want to tell you a story. This is the story of a girl called Laraba. On the 12th of October 2010, Laraba was out playing with her friend. And then her neighbor beckoned on her. He sent her to get something for him at the nearby kiosk. Laraba went to get the item. On her return, she tried to knock on the door, which happened to be open. She entered into the house. Dangiri, who was her neighbor, locked the door harshly behind her. He overpowered her and took advantage of her. After which he let her go. Laraba ran back home in tears with stains all over her, and her mother saw her. In the spate of all of that, the mother immediately called her father. Laraba's father happened to be a firewood seller in the market. Of course, Laraba's father left everything he was doing and angrily stormed to the house. On finding out about the daughter from the mother, he stormed to the assailant's house. And in this kind of cases, it was jungle justice that was on his mind, which is one of the risks of this kind of things happening. With all of this, lucky for Laraba, Laraba was taken to the hospital for the physician to see, consult, and then make an assessment. In Nigeria and most parts of the world, 7% of cases of rape is only what is reported. When rape happens, what do people do? Parents should not watch any evidence of rape. They should make sure they take snapshots and recordings, audio or visual, where possible and where necessary. The next thing that should be done, the child should be taken to the police station. In Kano, we have the regular police station and then we have the Hisba police. who both have direct departments responsible for sexual assault. From there, they are usually brought to the hospital. It can be vice versa. You can go to the hospital first and then go to the police station, whichever comes first, as long as there's documentation. The advantage of going to the hospital eventually, whether going to the hospital first or last, is that whatever happens remains confidential, because the doctor, the physician, is bound by the oath of confidentiality of the patient. And so the parents or the family should not fear the information being open to the public. And after the medical consultation, medical examination, medical therapy, the child must have psychosexual counseling. This gives the child better outlook on life and better outlook on the future. We have to teach our children to learn to confide in us. Once there are abnormal happenings, these children should confide in the father or the mother. This happenings could be anywhere. It could be in school. It could be anywhere. It could be on the street. It could be in the street corners. However, if your children don't confide in you, you might not find out the aberration to the normal that just happened or that is happening right under your nose. Teach your children not to accept being touched in abnormal places. Men should not touch them in the wrong places. If that happens, they should report it to you. Make sure you have a high degree of suspicion of any man that is hanging around your child. There are men who invite little girls to their houses to watch television because of the state of poverty in the land. Some people cannot afford to have a television. If your daughter goes to men's houses to watch television or is invited by men to watch television, you should be aware and stop that act. Teach your children not to receive gifts from men without telling you. If that happens, you must know and be aware. Make sure you get educated on the signs of rape in children. In the case of Laraba, her parents saw her when it happened. However, some children are too small, while some others are too embarrassed to voice it out to their parents. If you don't watch out for the difference in that child's behavior, you might not know what is going on. Maybe until the child presents with a pregnancy or difficulty in passing urine, which we call urinary tract infection, or sexually transmitted disease. We should beware of the Harmattan season, especially in Kano, northern Nigeria. That is because the Harmattan season marks the peak of sexual abuse in this part of the country. The steady increase in female sexual abuse and child sexual abuse in Kano is increasing and is becoming alarming. Therefore, it is our individual and collective responsibility to raise our voices and everything we can do to stop and reduce the prevalence and the incidents in our societies and in our community. What are the complications of rape and sexual abuse? It could be physical, bruises, swelling, injuries on the face, on different parts of the body. There could be lacerations, there could be fractures. There could also be injury in the perineal area. There could be injury in the female genital tract. There could be infections. There could be urinary tract infections. There could also be unplanned pregnancy and the likes. Other injuries include emotional injuries. Emotional injuries include guilt, stigmatization, depression. There could be anger. The person can become hostile. There might be sexual dysfunction, and then there might be long-standing pain in the pelvic area. This long-standing pain is usually psychological, it's not physical. Then the long-term effects could also be medical and psychological. They include the risk of re-victimization and then self-destructive behavior. Just like in the story, Laraba could be anybody. Laraba could be cow, Laraba could be kaka, Laraba could be Erua, Laraba could be gogo, Laraba could be danua, Laraba could be anybody. When anyone is a victim, it is important that you report to the hospital and also report to the police. I remain Dr. Nkem Ndiche, also known as Dr. Dele. Thank you.
Ai, huduma we kasikani tunga